the Chairman of the Presidential Task Force, Honorable Ministers, members of the PTF, gentlemen of the press, good evening. As stated by the Chairman, we are in the process of relaxing the third phase of the response. The PTF has reviewed the month of October under the national response. Our major priorities at this phase of the third response are to continue using data and science to inform decision making, improving the efficiency of response activities, and emphasizing personal responsibility of individuals in preventing transmission. We know that significant progress has been made in achieving the objectives of slowing transmission, preserving lives, and addressing disruptions caused by the pandemic. However, the level of compliance with non-pharmaceutical interventions does not support a complete relaxation and easing of restrictions at this time. We have used the following criteria to evaluate the success in this phase of the response. This included sustained reduction of new cases nationwide, increased sample collection and testing rates, a reduction of the death rate to less than 1%, a reduction of the test positivity rate to less than 5%, and the placing of measures to manage potential secondary outbreaks. It is therefore the informed recommendation of the PTF that Nigeria maintains phase 3 of the response with further changes to address economic, socio-political, and health concerns. In this regard, and effective from Monday, 19th October 2020, a minute past midnight, the following guidelines will come into place. These recommendations are made in line with our 3 established thematic areas: movement, industry and labor, and community activities. We have developed guidelines with the NCDC and NYSC in the preparation for the reopening of the orientation camps on the 10th of November 2020. The PTF has also arranged for additional safeguards to include the testing of all corpus and staff in the camps for COVID-19 prior to commencement of the orientation programs. It is also time for schools to open, but to open safely. And in this regard, we have continued with providing guidelines and engagement with states to ensure close supervision and oversight as schools open. The lifting of restriction on outdoor sporting activities, including football, is in line with earlier consultations with the Federal Ministry of Youth, Sports Development, and the NCDC. However, this is limited to the actual sports itself, not with mass gatherings. So in this regard, mass gatherings, including at sports events, is still restricted, as these represent an opportunity for the virus to spread with an increased risk of a second wave. For gatherings in enclosed spaces, this will continue to be limited to only 50 persons with physical distancing and compulsory wearing of face masks, except for workplaces. The PTF also believes that it is now time to allow civil servants of all grades to resume work safely. Additional guidance will be provided to heads of MDAs. Chief executives and heads of MDAs are responsible for ensuring the strict enforcement of non-pharmaceutical interventions and making sure that the work environment is safe for their staff. Face masks are expected to be worn in every public building, including government offices, and the PTF expects the chief executives to make sure that this is enforced. We also expect temperature monitoring at points of entry into government offices, as well as the availability of hand washing or hand sanitization facilities in every government building. For civil servants that are resuming from Monday, those below the grade level of 12, the MDAs should make arrangements to ensure physical distancing and avoid overcrowding. The PTF is recommending that they should resume and have alternate day attendance rather than everybody going to the office at the same time. The further relaxation of restrictions at this stage of the response will require additional safeguards, and these include the close monitoring of the impact of reopening schools and airports for international travel, supporting states in developing and improving sample collection sites, continued engagement of states that have low sample collection rates, enhanced surveillance across the country, coupled with piloting of new rapid diagnostic test kits, and monitoring the utilization of funds provided to the 32 states for COVID-19 related activities. I will now expand on some of the key issues that have to do with the relaxation of this phase of the response. For general movement, the curfew remains from 12 midnight to 4 a.m. There are no formal restrictions of movement outside these hours, but the risk still remains, and therefore vulnerable persons are strongly advised to continue to avoid unnecessary contact, particularly mass gatherings or leaving home, to protect themselves by continuing to remain away from the general public where possible. For air transport, aviation services have now fully resumed. Guidelines for international travelers are in place. Only travelers and airport staff to be allowed into airport structures. We continue to work on improving the portal. We will also continue to work with the state governments to ensure more and more private laboratories come on stream so that the cost of testing for travel continues to come down. The generation of QR code, the barcode, following the use of the portal will be made compulsory for admission into the country. But the QR code can be generated without payment, either as a temporary code or after payment as a permanent code. We expect all passengers from next week to start using the QR code and uploading their COVID-19 PCR results, as well as filling the health questionnaires online, because we will be moving away from the use of paper at the airports. For land and rail transport, there are no limitations on inter or intrastate travel, but all vendors and service providers must abide by stated stipulations from the Federal Ministry of Transportation and ensure that all NPI measures are applied. I have already spoken about the arrangements in the public sector for the resumption of offices, including MDAs, and all offices are requested to ensure they are ready to receive their staff by this coming Monday. For communal commercial spaces, the PTF will continue to push for the institutional ownership of the response. In other words, store owners must take responsibility for compliance with non-pharmaceutical interventions, and facility owners and managers must ensure that physical distancing is observed, as well as the provision of hand sanitizers and hand washing facilities, including the mandatory use of face masks. We will continue to insist on the policy of no mask, no entry, and no mask, no service for communal commercial spaces. For the hospitality and entertainment facilities, hotels to remain open, but observe all non-pharmaceutical interventions. Amusement parks, gyms, and cinemas to continue to operate at half capacity. Event centers with outdoor spaces to remain open. Eateries and restaurants to open only for outdoor seating services. Bars, lounges, and nightclubs to remain closed till further notice. The National Youth Service Corps, we have already put in place arrangements to allow the opening of the camps, and I will be talking about this in greater detail next week, Monday. For schools, we continue to work with state and local authorities to ensure that guidelines are in place for the safe reopening of educational institutions in line with COVID-19 protocols. We continue to strongly recommend that this opening is done in phases and carried out in stages to ensure that our students are not put at increased risk, and neither are their parents, grandparents, or relatives that are vulnerable are placed at greater risk. So educational institutions to continue working with the state governments to ensure the safe opening of these schools. There's no change for the religious places of worship. The advice remains the same. And for gatherings, we continue to limit this to 50 persons in enclosed spaces, provided physical distancing rules are followed. But in general, outdoor gatherings are preferred. For hospital visits, we advise that visiting sick patients is limited to only immediate family members. The details of the relaxation of the third phase of the response will be published in all social media and normal conventional media for the public. Thank you.
Thank you.